So, hi, Sarah. Welcome to the MedTech20. Super happy to have you on the show today and looking forward to having an interesting discussion about your business and some of the work that you've done, not only in the medical technology space, but outside of that as well. So, welcome to the program.
Thank you very much. I'm really pleased to be here.
So, Sarah, you're one of the founders of the Angel Academy business, dating back to 2014, and I'd love to hear a little bit about how you got started in becoming an angel investor and setting up this business, and a little bit about the journey and where you're at today.
Okay, well, I suppose the journey started with me kind of falling into angel investment, which I think is what a lot of angel investors say, that a friend was raising funding for his business, and although I'd met kind of various angel investors during my career, and I'd never saw myself as one of them, but he was raising money for his business and he was being a multimillionaire to do it. That, these things called investor syndicates, where a group of investors would invest together, and you can start with 10 or 15,000 pounds. So that was my start. And then I kind of got the bug from there. I went and joined various other networks because I wanted to learn more about how it worked. And I quite often found that I was the only woman in the room. I wasn't meeting many other people who were many other female angels, and I thought something was missing. I thought our perspective was missing when founders came to present to these groups, and particularly strongly for female founders, regardless of their proposition. I thought that it was crazy that women weren't contributing to this world. And also I thought it was, sad that women were missing out on the opportunities that angel investing brings. So a couple of years later, formally launched Angel Academy. I'd been doing quite a lot of research and building networks before that. We made our first investment in 2014, and now here we are towards the end of 2020. We've just completed our 34th investment into a business. Yes. So,
Fantastic.
And that's actually a health technology business. So
Okay.
selling to the NHS. So that's very, very, very relevant for today's call.
Yeah, fantastic. And we'll talk a little bit further about some of the investments that you guys have made in the healthcare space.
One of the things that I should say, that we've never been kind of anti-men in any way. It's about bringing more women in, not excluding men. So all the businesses that we've invested in have at least one female founder, but quite often they're co-founded by men, probably more often than not. I always joke our diversity target in our network is 30% men. So we're about 70% female. This is amongst the investors, 30% men. And, men make a great contribution as well.
Great. So thanks for sharing that. The Angel Academy has made investments in a variety of different sectors, and obviously we're on the MedTech20 today. So wanted to talk a little bit about the investing that you've done in the medical and healthcare sectors. I know some of the businesses. I know Giovanna at Forte Medical, and I've read a little bit about Dynamics and Raremark. But what excited you initially about investing in that space in particular?
Opportunity is huge.
Sure.
Goes without saying, doesn't it? So that's what we're looking at, is big markets, big potential markets. Healthcare systems are struggling in so many different ways, so it's a very exciting opportunity. There are some great businesses coming along that have huge potential to make an impact and improve how healthcare works. And I think one of the things that's very positive is that medicine and life sciences are already very gender diverse sectors. So we're getting lots of great female founded and co-founded businesses as well. There's no shortage of women in those sectors. As an angel investor, it's always great to have a sense of, doing good while trying to make money as well. That said, I think most of the investments we've done in this space have been around technology. So although Forte Medical is a urine collection device, we probably do more software than devices, and just you know, kind of huge opportunities to apply software to various areas of medicine. So computer vision in diagnostics, for example, using some software for remote management, you know, data analytics. Improve Well, that I mentioned earlier, is a software tool for frontline staff, and it's basically to support them. So yeah, huge potential, I think.
I think you're right. I think the digital technology in healthcare is becoming ever more present, and there's just so much you can capture from a data perspective, and so many interesting things you can do with digital healthcare these days. It's really an interesting time.
An aside about that, I went to see my GP right at the beginning of COVID, and suggested to him about doing consultations, you know, for some of his patients, not everyone on Zoom or Skype. He was absolutely horrified. He was saying, oh, no, that wouldn't work. And this was a young guy, perfectly bright, and yeah, and then, you know, just a few months later,
here we are.
Yeah, exactly. It's, you know, it's really kind of interesting how it's forced some kind of quite profound behavior change, hasn't it? And,
Yeah, absolutely. I think you know, despite all the clear negativity that's come out of COVID, I think there has been some positives in how we're going to look at things going forward. So good. So in terms of some of the medical businesses you invest in, you know, we talked a little bit about the digital piece. You know, what are the criteria you use when you look to make an investment in the kind of medical technology side of things, and do you actually have some other input in terms of vetting the technology and that kind of thing?
So, I mean, you know, we're a network of angel investors, and we've got a huge range of expertise within the group. So we have people who've either invested in medtech before or have some relevant expertise. We've got patent lawyers, so people who can look at any IP that's being applied for or registered. So, you know, we try and draw relevant expertise into the deal team for any opportunity we're looking at, and that's the advantage of being part of a network. You know, even if it's not a technology, you know, there's somebody else who will know it. I think, you know, there are some standard things that you always look at for any business as an investor. You want to look at the team. Are these the right people who can deliver on their rather ambitious project promises? You know, is the problem they're solving really big? Does it excite us? You know, the market size has got to be decent. It's also got to be accessible. You have a look at the competitive landscape. So whatever business we're looking at, we'll be evaluating those things. You know, specific technologies, as I mentioned before, we'll find relevant expertise within the network, but we can also speak to customers and users. So if they're using the technology, we can find out from them how well it works and how responsive the team are to getting things fixed, or ideas for future features and things like that. And of course, you know, we spend some time talking to the team. I think a couple of things that's worth mentioning in the context of medtech and health tech are you know, the NHS in the UK. We've got this big single buyer, which on the one hand looks like this fabulous opportunity, but, you know, we have learned the hard way that it is a really, really difficult organization to sell to, and even people are inside. You know, one of our businesses has spent the last 12 months or so trying to get the NHS to sign a contract for something that they're already using and have agreed to pay for. And we've got the chief executive of the NHS Trust who's personally behind it, but can it get through the IT department? And, you know, I know you're going to ask about regulation as well, so I'll let you get on onto that piece, because obviously that's critical.
You're absolutely right. I'd love to ask you a little bit about the regulatory framework, because perhaps that's different than maybe some of the other investments that you make. So are you bringing in consultants and that kind of thing to help you with that part of it?
Yeah, we haven't brought in anyone from outside the network so far. You know, we also invest in finance and fintech, which is another regulated area. So you know, we do have experience of regulated markets. I think what we try and do with each investment is understand what the regulatory risk is. There are people with relevant experience in the background is part of the network, so people that we can help. But you know, one of the upsides of regulation is actually it creates a barrier to entry for other companies, so it can be a competitive advantage if we're confident that this company will get through the regulatory process. So you know, we expect them to be very well informed about what it is they're up against, and then we can validate that with some external feedback.
Yeah, that makes sense. Have them be prepared to do some of that, obviously, from the outset.
If they don't know, then God help them.
That's a very good point. So, Sarah, are you able to share a little bit about some of the possible future investments you are looking at potentially in the medical applications and technology space?
Yeah, sure. I mean, we're very interested in seeing sort of health and medical applications. So it is a popular area for the group. We've got lots of experience in software and digital technologies, as we touched on before. So, you know, businesses that are using artificial intelligence and machine learning to triage or speed up or improve diagnosis or improve how trials are run, those sort of things would be of huge interest. We've also done a few investments in businesses that kind of increase the efficiency or the safety of processes and procedures. You know, sometimes how kind of healthcare businesses are run, helping a lot of healthcare businesses, we're talking outside of the NHS, may be quite small. So there's a lot of business automation that can be added to them. You know, software for remote monitoring is very interesting. We've got another business that we've invested in is kind of building communities of interest. So sufferers and families and the carers of people with rare diseases, for example. And you know, the disease will be rare in any one geography, but across the world there are significant numbers. So you know, that business has done extremely well. I think, you know, we haven't done so much hardware, but you know, that is something that we will look at. Of course, we've invested in Forte Medical, which is a urine collection device that makes urine collection a lot easier, safer, and more accurate, especially for women, which is so important in the prenatal environment in particular. And we're also, fingers crossed, about to complete an investment in a fertility device. So stay tuned for news on that. So that's a new area for us. Be very open to seeing robotics opportunities. That's an exciting space. I mean, you know, any kind of innovative materials that we could use in a medical environment. You know, the amount of single-use plastic that's being used by the health services is very worrying. So it'd be good to see, you know, some innovation in that space. There's sensors, there's IoT. You know, we're open to all of it. We've done one biotech investment actually, but it's less of a medical application. It's lab grown meat. So that's the only area where we've strayed into anything at the molecular level. So that, you know, that's probably not where we're going to go in future, just because, yeah, that, that is harder expertise to source within our network. So,
Right.
think more of hardware, software, digital, but where there is some sort of substantial intellectual property behind it as well. So really, really exciting, and just kind of, the potential to make a big difference with your investment.
At the beginning of the conversation, we talked a little bit about the story of the Angel Academy, and how part of the vision was to really bring more light to women in leadership, in terms of bringing these businesses to fruition. So what would you say about how the landscape has maybe changed over your time with the Angel Academy in the investment community since 2014?
I think, one very significant change is just the number of female founders. So now a third of all new businesses are started by women. So just the sheer the sheer numbers have grown, and a significant proportion of them are now building scalable technology or IP based businesses. So either are or will become very investable. So that's another step change. And also on the investor side, there's a lot more awareness of the challenges and the bias that is faced by female founders. And so we've been able to mobilize a lot of female angels on that basis, that a lot of them in their own entrepreneurial or their own business journeys kind of suffered from being the only woman in the room, and so are kind of quite motivated by our mission. And likewise, the venture capitalists, so the people who are typically investing at a later stage, are very interested in our portfolio because they want to build pipelines that are a little bit more diverse than the typical companies they're introduced to.
Yeah.
So I think there's lots of good and positive happening and awareness, but unfortunately we still have a situation where female founders are receiving less funding at lower valuations, particularly in male dominated sectors, than they should be. So there's still a little bit of work to be done, but there's been some encouraging progress.
Yeah, and it's going to be a work in progress, like
of course,
everything, I guess. But it sounds like it's all moving in the right direction, which is great.
Yeah, and and we can't do it. We can't do it on our own. We're relatively small organisations, but there are similar organisations to ours in different parts of the world. So gradually it's getting better, both for female founders and we're increasing the number of female investors. I think you need both.
So, one of the topics that inevitably comes up in almost every conversation we have these days is COVID and the impact that's had on how we do business and that kind of thing. So I'd just be curious to hear how it's affected your business. I mean, you're an investment community, so how has that impacted over the last 12 months almost?
Well, it's been a very tough year, and I think that's the same for probably most businesses. The fundraising environment has become quite tough, so our investors are investing a bit less than they would have done in previous years. Second half of the year, things have recovered somewhat, but I just talk about investor caution. So a lot of investors are kind of moving to backing the stage less risky investments, or ones that already have portfolios, probably earmarking their money to support those existing portfolio companies, because we've seen a lot of the ones that we have invested in come back for some emergency funding to get them through this challenging time. So investors will prioritize their existing portfolio, but we've done roughly half follow-on investments and half new investments this year. So we've announced 12 or 13 so far. So it is happening. it's been tough. And, you know, in terms of how we operate, it used to be very much about, you know, getting in a room together and meeting people and spending some time with the founders and their team and getting to know them. And, you know, I've heard investors in the past say, oh, you know, you can only do it in person, but actually, lo and behold, we've just had to get on and build relationships with people over Zoom. You know, it is a bit harder, but it can actually be done. So, you know, that's transformed our business, and I think some of that's going to stick even when once we're all vaccinated and able to go about normal business again.
Yeah.
I think some of the things we've seen in our portfolio as well are, you know, they kind of had to make really tough decisions very quickly, and I've just been kind of so impressed by how decisive, you know, people have been and the action they've taken. So, you know, the first thing that everyone seemed to do was kind of dramatically cut their costs, so give up their office space, you know, defer any payments where they could, you know, furlough people, even make people redundant, sadly. And then, you know, on the positive side, you know, several of them have executed some successful products. We've got, you know, one company, I just got an email from them the other day. They've just had their best ever month. So, you know, things are going well for them. And then, you know, there are some of the companies that actually didn't have to pivot. What's happened is that the world has kind of caught up with what they were trying to do. So they were already very well placed. So some of the online learning companies, for example, some of the community-based businesses, recruitment, you know, people are a lot more anxious about their employability. So are sort of joining up to platforms and things like that. So a tough year, but the resilience of female founders has amazed me. You know, I think the biggest challenge facing all of us is going to be figuring out what the new normal is. You know, what bits of our new behavior is going to stick and what won't, and what will we be going back to, and how does that inform how we make business decisions and investment decisions as well? Are we going to keep investing in Zoom-like businesses or Babylon Health, or are those going to become less exciting once you can go back and see your GP in person? It's, you know, really interesting trying to figure out what the future looks like.
Predicting the future, yeah, it's not an easy task.
No, but it's you know, it's kind of, you know, feel very lucky to to be able to have these conversations, and, you know, it's such an interesting time and an interesting thing to be an investor in all these kind of, you know, really exciting technology businesses, because it is, you know, we learn so much from them.
Yeah, absolutely. And you know, when I think about it a little bit more, you know, the businesses that you're working with are, you know, at the closer to the beginning of their life, let's say. You know, these businesses continue to grow and grow. How they will be structured maybe impacted by what we're seeing today and how businesses function. So.
Yes, it is a very interesting time. We're very lucky that we're working in the in the fields that we are working in.
Great. Well, thanks so much, Sarah, for all that you've shared today. It's really interesting to learn a little bit more about the Angel Academy, and you guys are doing some really interesting things. Congratulations on all the good things, and I wish you continued success in 2021. If folks want to reach out to you, what's the best way to find you?
Well, thank you very much for having me. I've really enjoyed it, and some great questions. Probably best way to find us is on our website, angelacademe.com, and Academy spelt ACADEME, so misspelt, just to make things a little bit tricky for you. Or feel free to send me an email or find me on on LinkedIn. I'm Sarah@angelacademy.com.